Hello, welcome back to my video. So this video, I'm trying to actually show and share with you how we go about dental photography and orthodontic consult. But apparently in this video, I've edited the part, the earlier consult of the appointment, and basically just to highlight about the photography and the final discussion and consult. So typically, our routine consult will be initial consult, and the rapport building, the problem list, and we take the photos, and later on we send patient for X-ray. So by the time the X-ray is done, the photo have been transferred to the patient own folder, and we can cross-check and discuss the necessary finding, and basically finalize the treatment planning in the same visit. So more or less, we can know for sure lah whether patient is a good candidate for extraction or non-extraction approach. So for this patient, we already taken his X-ray record beforehand, and in this edited video, we are only showing the photography and the final treatment plan discussion. So this is the real dentistry. Okay, this is unedited or scripted. So basically, the battery for the special mirror is kaput, fully drained. So we use the overhead light to assist us with the necessary light to help the camera sensor to pick up and take the photos for occlusal photo especially. Alright, as you can see in this video, I am not speeding up the video and it is in normal speed. The reason being is that to actually show you, for you to appreciate in normal speed, how fast is the total intraoral photography took actually. If it's less than 3 minutes. On average, it's around 1.5 to 2 minutes. If done right, with sufficiently competent assistant at the site. Yeah. Alright, the intraoral photography is done. So now we are moving towards the portrait photography. So typically, it will also take around 2 or 3 minutes max. So as you can see, I sped up the time slightly, but you can actually see the minutes there. So it will typically take around 2 minutes, at most 3. So actually it's very efficient. If if you drill down the routine, you basically set up the system, the lighting is very smooth, almost no friction. But of course, you need to take into account the time, 5 to 6 minutes for the photography side in your consult. So your consult cannot be done in 15 minutes. It's just impossible. So make sure you have ample time, at least 20 to 30 minutes for consult, because at the end of the day, we do not want to rush consult. We want to actually get as much as possible rapport building. At the same time, we want to be efficient in terms of our communication. At the same time, we actually want to close the case as best as we can without pushing patient, and make sure that patient is well informed, so that they are actually making decision while having sufficient information in their hand. So what better ways to actually convey or communicate is via photography, via pictures. As we know, a pictures is worth 1,000 words. So this is basically the wisdom to actually, we are not trying to rush communication, but we are trying to compress the communication that we are trying to convey using photography. So this is where the magic happens. So when we show photos of zoom in photos of patient oral health condition, the cavity, the recession, so that would be the light bulb moment whereby patient can actually see for themselves, and having co-diagnosis really smooth the closing process. We are not trying to sell dentistry anymore because patient can see it for themselves, the condition inside their oral cavity. Alright, I hope you can learn a thing or two from this video. Until next time, bye bye.